Worries about COVID-19 have left some avoiding care that could be life-saving. I'm joined by Dr. Jeffry Nestler. He is the chief of gastroenterology at Hartford Hospital. Thank you so much for being with us.
Hi, thanks for having me.
Are you concerned that some patients might have delayed very needed care because of COVID-19?
Yes, we back in mid-March, we ramped down actually all of our ambulatory surgery centers and hospital units. So we were doing a minimum number of procedures and cases, and patients were fearful of coming into the hospital or our ambulatory surgery centers to have the procedures that they needed. Plus, they did not come into our offices, although we did have televisits available.
So are you thinking that I know the diagnosis of GI cancers have dramatically decreased. Is that because you think enough people haven't been coming in?
Yes. It's imperative to have colonoscopies or colorectal cancer screenings. That's how we diagnose, especially colorectal cancers. Most patients are asymptomatic, and if they're not coming in for their routine screenings or follow-ups, one would expect that two things would happen. Number one is we would delay the initial diagnosis, and when we do diagnose it later on, it will be a later stage. And when you catch colorectal cancer early, there's a 90% cure rate. 5-year survival in later stages can be as low as 14 to 15%. So we were very fearful that was going to happen. And at Hartford Healthcare, we know that there's been a reduction of newly diagnosed GI cancers over the last several months by 60%.
Right, so we need to make sure that people are getting those screenings. What can you say for those who are concerned that maybe they're not safe going to get a procedure and they're thinking, oh, it's elective, I'll put it off?
So right now the concept is to create a COVID-safe environment for all of our ambulatory surgery centers as well as our hospital GI units. We symptom screen and temperature screen all patients. We symptom screen all staff members and providers before they come to our centers. We are also doing pre-procedure COVID testing on all patients that are coming to our centers. So we are trying to create a COVID safe environment for everyone that's coming there. And right now, over the last several weeks, as we ramped up, we've had 0 out of over 1,000 patients tested for COVID prior to coming into our centers, and there's been 0 patients testing positive.
That's wonderful.
That's unbelievable. So we are creating that COVID-safe environment.
Dr. Nestler, thank you so much for your time. We appreciate it.
Thank you.